And a lot of times this type of body work seems to help with things that are going on with a horse that aren't diagnosed, or they are diagnosed and they're not responding to treatment. So, you know, it's always good to start with a veterinary examination, because most things can be found and uncovered and helped. But I just wanted to talk about some of the things that have shown up with us with this type of body work, that this type of body that respond to this type of body work. And I did a couple of articles for Performance Horse Digest, which are that you can find them on our website. And I think that Performance Horse Digest puts the articles online. But hind end lamenesses are, in particular, have shown up a lot in the last few years that have been undiagnosed. They can't find a problem with the horse. There's nothing going on in the feet and legs and the stifles or the hocks, but when you do the body work, the horse, there's an improvement in the behavior of the horse, or the condition, or the performance in whatever is showing up. And the reason that it's hard to diagnose in the feet and legs is because it isn't in the feet and legs a lot of times. It's in the deeper core muscles and groin muscles, and the horse will I think it comes from caused by a lot of things. One will be the horse might slip or fall or kind of spread eagle, and from playing or running or whatever on a slippery surface, and they'll strain or they'll pull, whatever pull means, a muscle, a groin muscle, or a deep psoas muscle, a core muscle, and then all of a sudden they're short-strided behind, or they're short-strided on one side, and it appears all of a sudden. And when the horse has gone over by a vet on the feet and legs, they can't find anything, and often the sacroiliac joint's involved, and so the vets they can inject the sacroiliac joint, and so there will be an improvement, but it's not enough. The horse is still not going right. When you do this type of body work, especially the hind end points, which are very easy to do, the hind end release points, they send signals to the horse's nervous system to start to release tension in deeper muscles that aren't accessible from the outside. And often you'll see an improvement, but it's usually when it's something like that deep, it's not. You have to do the whole horse. You can't just do the hind end, because the horse is interconnected. The atlas is important. When the atlas is jammed up, the whole horse, there's problems with the whole horse, or anything going on in the body reflects in the atlas. Conversely, so you need to do the whole horse. There are other connections between the front end and the hind end that we recognize through just experience working with the horses. The longissimus dorsi muscle, which inserts in the lower neck, the lower vertebra of the neck on the front end, and that runs under the scapula on each side of the back, and attaches at the sacrum and the pelvis on the hind end. So if there is something going on behind, the horse's body is going to have to compensate, and it's going to affect the front end too. In just, as an example, the atlas and the C7-T1 junction, where the lower neck joins the body. So the point being that you have to do the whole horse. You can't just treat what you think is the problem, because the problem is usually it's a link in the chain, and there's a kink in the chain on one end. There's going to be a kink in the chain on the other end that's helping to that's affected by that kink. It's trying to compensate for it or trying to adjust it. So the point being, you have to do the whole horse. But these mystery hind end lamenesses are very often helped with this type of body work. The hind end points are the place to start. The hind leg releases, if done properly, very slowly, where you have the weight of the horse's whole hind limb in your hand all the way to the ground. It's a very slow hind leg release. That allows it puts the horse's body in a position to let go of these spasms that are deeper spasms, internal, in deeper groin muscles and psoas muscles and pectineals and all kinds of those Latin words that are way up inside there. So mystery hind lamenesses behind can be often helped with this type of body work. The front end, in my experience, a situation or a scenario in my experience will be a horse has a lameness in the front foot. Whatever it is, it's either a long-term abscess or laminitis, or a coffin joint problem, or flexor tendons, or whatever they might be, suspensory ligament injuries, and the horse is lame for a long time in front, and then when the injury heals or is treated, the horse is sound for a while, but then he's off a little bit in the front end, and then he'll be sound, and then he'll be off. And it's happened quite a few times that after the body work that goes away, and the reason is because the horse is compensating for something, an imbalance in front, and they start to get torqued in the lower neck and where the neck joins the trunk, C7T1 junction, compensating for that injury. So when the injury heals or is treated, then the foot or leg is better, but the twist, the torque is still in the C7T1 junction. So the front end body work will help to release that torque, and then the horse is sound. Well, the whole body is treated with the body work, and the horse is sound. But the issue was the compensation for that injury became the problem after the injury was treated. So these are examples of the mystery lamenesses, hind and front. And just this doesn't happen a lot, but you might have experienced it. Some of you might have experienced it, or might in the future. But it's just as an example of how the body works and how it's not just one thing that often is a problem. If a horse pulls the front shoe, if he hooks the front shoe with the hind toe and pulls the front shoe, in my experience, a lot of times the horse is and the shoe's put on, the horse isn't sound afterwards. And the scenario is they call the farrier, and the farrier comes and nails the shoe back on, and the horse is still not sound, and so they call the farrier back because they think there's a hot nail, or he didn't put the shoe on properly. That's not the case. But what's happened is when the horse pulled that front shoe, he's pulled himself out in the atlas, out of, if you want to say, alignment. Now, we don't deal with misalignments because the way I look at it, horse isn't symmetrical. They're not symmetrical. So to try to get everything perfectly symmetrical isn't the solution. But to release the tension that's causing the misalignment is what we focus on. And so when you release the tension in the atlas, that's been torqued by some kind of type of muscle strain from pulling the shoe in the front foot, all of a sudden the horse is sound again. So and just anecdotal, I guess it happens a lot with ponies more than large horses for some reason, when the pony pulls the front shoe. So that would be another example of a mystery lameness. So I thought I would start the talk with that, just from my experience with mystery lamenesses, and also to explain. I'm assuming that a lot of you already know what the Masterson Method is about, but if you don't, go online while we're talking and look it up. But when we work on a horse, we're not focused on fixing anything. If you're trying to fix something, then you're not going to be as effective as if you look at the horse as a whole and treating the whole horse. By trying to fix a specific problem, from my perspective, you're focusing in on something that's bothering the horse. If it's an actual problem and you get too focused on it, the horse builds up an internal brace against it. And when that happens, the horse is less likely to let it go while you're working on it. Then if you just look at the whole horse, treating the whole horse, then the whole body will release whatever the problem is. Rather than if you get too focused on the problem, then the body tends to go the opposite way. It tends to brace against it because you're focused in on something that's bothering the horse. And with this method of body work, the way we look at it is the horse is a survival animal. He's programmed to block out pain and to not show lameness, because if he does, then he's picked off by a predator or kicked out by the herd. So the horse, their natural instinct is to just cover up the problem. And when you focus on the problem, the horse works harder at covering it up. When you back off and back away from the problem and soften, then the horse's body releases the problem. So that's one of the fundamentals of how this method of body work works. So the point being, if you try to fix the problem, you're just activating the horse's defense system to brace against the problem. So for those of you that don't know about this method of body work, and you're just The Voice isn't on tonight, or American Idol, and you just have nothing to do, and you thought you'd check this out, that's how it works. So is anybody listening? We don't know your names. You're still anonymous. Does anybody not have any idea what this is about? Go ahead, speak up. All right. Okay, we can take the rest of the night off.
Oh, no!
No, okay. Okay, So I want to talk about what you guys want to talk about, but I also want to answer some questions that came on that the people emailed in. And I think I'll start there. Unless, wait a minute, why don't I start with, does anybody have any question about what I've been talking about so far? Or any question before we get to this? Nope. I see you're on here, Pete. How are you doing?
Good, Jimmy. Can you hear me?
Yeah, I can hear you. Okay, somebody started to ask a question?
I don't have a question, but I am so amazed by this method. Thank you so much.
You're welcome. I'm amazed by it too. Pretty much every day.
And you know what?
Yeah?
What you were saying makes so much sense about treating the problem versus the whole horse. Total sense.
Yeah. I mean, the word holistic is kind of used a lot, but it kind of makes sense from this perspective. When a lot of times when I think of holistic treatments for anything with humans, I think, well, okay, I'm gonna get some herbs and I'm gonna get some something, maybe some whatever it is, and I'm gonna treat the whole body holistically, but I'm hurting here now and I want it fixed, and so I kind of discount holistic sometimes from that perspective. I get acupuncture and I get other modalities done to keep myself going, but when I really have something hurting, I want something that is going to fix it. But with horses, this type of the big picture for some reason seems to work better. When you treat the whole horse and you don't get so focused on the problem, the horse's body will start to do its job and let it go. You'll kind of bypass that survival bracing response by looking at the big picture. So it's almost, you still have in your mind the problem you're trying to address, whatever the performance issue is, or whatever well, it all boils down to, well, not all, but a lot of it boils down to a performance issue, because we're not, we're not veterinarians and we're not trying to treat specific problems, but they show up in the horse's performance and behavior. Most of the issues that we're trying to improve on or fix, they're showing up in the horse's behavior or performance. So in that sense, it's a performance method of performance, improving performance in the horse, but you're finding out what's causing it, and you're getting the horse is releasing what's causing that performance issue. So I got going and I forgot what I was going, where I was going, but oh yeah, by treating the whole horse, for some reason the horse will do its part in releasing the tension if we don't get too focused on the problem. And so we do end up fixing things that are big problems, big issues with the body work. So it's kind of interesting. And my take on it is, with the horse doesn't have, as humans, we have a lot invested in our problems. We have this little record playing all the time with all kinds of stories, and we don't even hear them all the time. And so that's interfering with our body's ability to balance itself. Whereas the horse doesn't have that so much. The horse doesn't have that analytical, reasoning. We have all these reasons why we have problems, and the horse doesn't have all those reasons. When the horse feels something let go, it lets go. There's no analyzing it. So now the horse will try to resist it and try to fight it, because their natural instinct is to cover it up. But once you get under that bracing and that natural defense system, which is what we do with all of this body work, every technique we do gets underneath that survival response, then it lets go. So I think that's why that works, that focusing on the whole thing. Before I start reading some of the other questions here, does anybody else have a question? I'll just have a little.
Jim, this is Freddie from New York.
Hi, Freddie.
Hello?
Hi.
Hi. I met Coralie in August in Springville, New York, and she said something that has stayed with me all this time, or she said it to the group, of course. She said that by the time that you see lameness in a horse, the injury or the issue's been there for quite some time. Mm-hmm. So if that's the case, is it that they just cannot, because they're prey animals, they cannot brace against it or hide from it anymore, and that pain has been building, or that tension's been building all this time, and we just didn't see it? And is there a better way to maybe note that pain?
Yeah, that's a pretty good description of it. Now, a horse will have an injury where it just injures. A horse has an injury immediately, and it's so painful that they can't cover it up. But in a lot of times the horse, well, a lot of times the horse is building up tension in its body, and it's compensating for issues that are starting to show up, discomfort, and so they compensate, but a lot of times it gets worse and worse and worse and worse to the point where they can't cover it up anymore, and that's when they start to show the lameness, because as you said, it becomes so uncomfortable or painful that they can't cover it up. I mean, they try to cover it up and they go as long as they can, but it reaches a point where they just can't. And some more discerning eyes can start to pick it up earlier. People that are used to seeing horses go, veterinarians that do a lot of lameness work, they're used to seeing horses go, and certain trainers are used to seeing horses go all the time, and so they'll start to pick up earlier. Or the riders that are pretty much in tune with their horse will pick it up in the while they're riding the horse in the seat before it's visible. So it starts to show up gradually, but then it reaches a point where it shows up, and then that's because the horse isn't able to cover it up anymore. So I think you're right, and Coralie was right in that. So yeah.
Thank you.
Yeah, they are survival animals. They're trying to. They don't. And some horses are more tougher than others, more stoic. Some horses, they'll just deal with it and block it out and block it out, and all of a sudden they show up lame, and the vet comes to look at them, and it's just like, wow, this horse is a wreck, and you had no idea the horse is a wreck because it was so tough at covering it up. And other horses are a lot more sensitive and expressive. They're a little bit, I don't know, everybody knows the horse that's the drama queen, like the slightest little thing, they start to show it. But the horses have different personalities and different makeups, but they're all trying to cover it up instinctually, trying to block out that the signs of lameness. The other part of this equation for me is that horses survive. They communicate with body language. They don't have a huge verbal vocabulary, and except for Mr. Ed, he had pretty good vocabulary. But other than that, they don't have. They communicate by body language, and they communicate by very subtle body language. And so if they do start to show it, then the other horses are going to notice it, and they're going to start to push them out of the herd. But when you learn how to read, once you learn how subtle that body language is, and you learn how to read that body language, which is what we do with this method of body work, we learn how to read the horse's responses to our input, to our touch. Once you learn how to read that, and you practice, the more you practice, you get, the better and better you get. That you're able to start to notice early, before, as you're working on the horse, you start to notice what's going on before the horse is showing it showing it more in grosser terms. With the bladder meridian technique, I mean, it's so simple. You run down the horse's bladder meridian or anywhere on the body, and one of the questions here is about how to tell if your horse has sore stifles, or other ways of telling. But when you do this bladder meridian, really light touch anywhere on the horse, and you look for those subtle responses like the blink or lips twitching, and then the larger releases like licking and chewing or whatever, the horse's body will tell you a lot just from doing that. And you're not even touching the horse, barely touching the horse. You're just bringing the horse's awareness to something that's bothering the horse, or some tension or some discomfort. You're bringing the horse's awareness to it by going over it lightly with your hand in a way that the horse can't brace against it. The horse can't brace against no pressure. So you're in essence, you're tricking the horse's body into telling you what's there. But that's how subtle the horse's body language is. Some horses that we work on, and that when I'm teaching seminars or courses, I'll have students come and they'll be doing the bladder meridian on a horse, and it makes the horse so uncomfortable that they have to back off, and they have to back off, and they have to back off, and sometimes they'll back off that far with their hand until the horse is comfortable enough that they can go down the bladder meridian that far away from the horse. So that the horse is able to handle it, and it'll work. You'll go this far off the horse's body, down the body, and you'll get a blink, and you'll stop there, and then you wait, and you'll start to get the fidgeting, and then you'll start to get the releasing, and it's because the horse is so sensitive. Once we bypass that bracing response, their body language is so sensitive that we can read it from that far away. So It is pretty amazing. Again, I forgot where we were going with that, but we were talking about body language. One of the Dorrance brothers, I don't know it was Bill or Tom, said, I think I read somewhere that they said that the ride begins when the horse sees you get out of the car. So they're tuning into your body language long before you are aware of what's going on. So we use that, learn that body language with this method of body work to see what's going on with the horse, whether they're sore, whether they're hurting, and when they're releasing. So anybody else, anything on that or anything else?
No, but that's really, that's very cool. I like that.
Yeah, and it's easy to do.
Yep.
So I'm going to start reading some of these questions. So, okay. So this question. My wife is fooling around with, no, that's Dear Abby. Sorry. That was, no, that's not, it's a different one. I had the newspaper out, sorry. Okay. My question is, my 13-year-old mare enjoys the bladder meridian technique, and I get some nice big yawns from her. However, occasionally, after a little while of working on her, she begins to do a funny kind of open-mouthed grimace. This is something that she does sometimes in other circumstances when she's either feeling impatient, e.g. she can see her food coming, or when she needs to move her feet, e.g. we're waiting to cross a road and I need her to stand still. Am I doing something to make her feel stressed? P.S. I haven't done any courses yet, but I've been using the book and DVD. So that kind of it kind of relates to what I was just saying. So and this happened. Some of you might have experienced this, and a lot of people experience this. And the question comes up as you're doing the body work on the horse, and often it's as simple as doing the bladder meridian on the horse, like this lady does. At some point, the horse starts to kind of work its jaw. You know, it turns its head sideways and starts kind of grinding its teeth and grimacing. And what's happening is the horse is feeling some sensation that you've brought its attention to. So all of a sudden, you're doing the bladder meridian, the horse starts doing that. That's his response to some sensation he's feeling, and the sensation he's been blocking out in his daily normal life. It might be tension in the pole, it might be tension in the TMJ, it might be tension in the neck, and I'm just guessing on these. You know, the interconnections in the horse are so huge that it could be something behind, but he's feeling some sensation. But I think, you know, in my experience of working on the horses that do this, that they often have a lot of tension here in the TMJ and in the jaw, and the tongue release.
Brian.
The tongue release helps a lot with that, and so it is good. It is good that that the horse is doing that, because he's feeling something that he's been covering up. Does that make sense to anybody? Oh, I think somebody's got their needs to hit their mute button, because we can hear what's going on in your personal life. So you need to be careful what you say. Okay. Unless it's interesting, you can keep going. So, anyways, it's bringing the horse's awareness to some sensation that they've been covering up. So when this horse, for example, we'll leave the food out of it, because the food, it's different. But when the horse is waiting to cross the road and she makes it stand, all of a sudden it gets fidgety and it starts to feel things that it's been just blocking out by. A lot of times these horses are very busy horses, and all of a sudden you take away their busyness and they'll feel the sensation. So that's my take on what's going on. But what do you do about it? It's good. You just do more of whatever you're doing. You do more of the bladder meridian. You do more of bringing the horse's awareness to whatever it is. And like I said, a lot of times that behavior is related to stuff in the pole, in the atlas, in the TMJ, and in the neck. So you just do more work on the neck in that case. Anybody have anything to say on that? Okay, we're going to the next one. First we'll have a little sip of wine. Okay. Okay, Jim, what exactly are we accomplishing with the Withers release technique? Please be as detailed as possible, including anatomical structures and biomechanics of movement. Thank you. And I think this is from a student, because we teach in the advanced course, the withers release. So I have brought this really cool book, Beyond Horse Massage, that has some anatomical drawings in it. And I mean, this is, I mean, I'm happy to share this with you guys, even if you haven't done the advanced course, because it's important what goes on with the horse's body. The withers are the, you know, they're the the part in front of the saddle and at the bottom of the neck, and they between the shoulder blades, between the scapula, and they are, I don't know if we can see this. Yep. I gotta practice here. Get down here. This is from Beyond Horse Massage. This actually drawing is on page 34. But the withers are the spinous processes right here. I'm gonna sneak up here. Go that way. The withers are the spinous processes of the thoracic vertebra right here, between the two scapula of the horse, between the two shoulder blades. So the horses, oh wait, we have a better drawing here. It's actually a real horse. There we go. Get the right distance. So the withers, the horse's trunk runs between the scapula, the shoulder blades, and the neck joins the trunk right down here at C7. And then the withers are the spinous processes of these vertebrae of the trunk. And they get pulled, the horse's body starts to twist and torque, and the withers become pulled to one side or the other. And it's not just the withers, those spinous processes of those vertebrae that are pulled to one side or the other. It's the whole rib cage is part of the process, plus the shoulder blades that are clamped on each side of it. There's no joint between the shoulder blades and the body. It's all connected by muscle. And so for whatever reason, just like I said, horses aren't symmetrical. They're unilateral. I mean, a unilateral tension develops on the horse through work or from a little bit of lameness on the front end and a front foot being a little more uncomfortable than the other on one side or the other, or an imbalance behind on one side or the other that creates the horse's body adjusts in front. But for whatever reason, just like humans, we're not symmetrical and we get tension pulling more on one side to the other. So those spinous processes get torqued or pulled to one side or the other. So with the withers releases, we're applying pressure to each of those the spinous processes of those vertebra. I'll go from this side. These are the vertebra. Here's the shoulder blade. Here's the head. So here's the from the head. Here's the wither. So we're applying pressure to each of those spinous processes in a way that allows the horse to release the tension that's pulling those withers to the one side or the other. And that's what we're doing with the withers releases. The withers for us is right between our shoulder blades, our spine right between our shoulder blades. So when we get a knot on one side of our a vertebra between our shoulder blades and our back, it's pulling stuff to one side. So with the withers releases, we're releasing the tension that's pulling it to one side or the other. So for Allie, that's specifically what we're doing. The anatomical structures and the biomechanics of movement. The trunk has to, the horse's trunk and rib cage has to be able to move independently somewhat of the scapula that are attached on each side. They have to, where are we? Okay. I don't know if we can see that. Get over closer. You can see the scapula. You can see the thoracic trunk. You can see the C7-T1 junction, which is where the neck joins the body. But the trunk is hanging between the two legs in the front end. And the muscle and the connective tissue that attaches the two front legs and through the scapula and the forearm to the trunk has to be healthy. If it gets tightened up more on one side than the other, it twists the trunk one way or the other. Also, the whole trunk has to be able to lift between the withers and to sink between the withers. When it all becomes jammed up, there's no the horse can't absorb concussion from the legs into the trunk, and also there becomes restriction in the range of motion. There we go. Wait, range of motion of the front limbs. So I think that's the importance in movement in the horse, that there has to be flexibility between the forelimbs and the scapula and the trunk in order for the horse to have range of motion in front, in order for the horse to be able to lift in the trunk and lift in the withers, especially in dressage. In order for the horse to be able to do lateral movement in, for example, dressage, cutting, reining, spinning away from a garbage bag. You know, if the horse is going to spin and leave you hanging in midair effectively, the horse has to be able to reach out in front. So it's important in a lot of different respects. So that's the answer. That's my answer to this question about withers release and the anatomy and the biomechanics of the movement. I mean, that's just looking at it on one level. I mean, the longissimus dorsi muscles, the long back muscles, run along each side of the withers, from the hind end to the lower neck and front. They run on each side of the withers. The diaphragm of the horse inside of the trunk it's a huge factor in the horse's performance and health. When things tighten up in the trunk and in the withers, it affects the diaphragm. Or conversely, when the diaphragm tightens it up, it affects the whole rib cage and trunk of the horse. So the withers releases do a lot of things. It's not just, you know, just the direct biomechanics of movement of the limbs and raising of the trunk are just one aspect of it. Okay. Okay, we're going to do a question check. Anybody? Nope. Okay, I'm going to celebrate every time nobody has a question with that sip of wine. Since you're not asking questions. If you're asking a lot of questions, I'd celebrate the questions. But okay, here's my question. I work with a black Percheron that has a cow kick on his rear right side. Parentheses, he kicks out sideways like he's swatting flies or stretching his leg out. The vet assumes he was previously injured when younger. He is new to the stable I work for about a year and only does the cow kick occasionally. He's used to pulling a cart, so I suspect it is muscle related. I'm wondering your thoughts. And besides doing all the great Masterson Method positions, do you recommend one move more than others? So if he's cow kicking, horses do everything for a reason. So if you're the reason and he's cow kicking at you, that could be it, but that doesn't sound like that's the case here. It sounds kind of like it's just it just happens out of the blue. He just cow kicks. So he's reacting to some kind of sensation, as same as with the other question, and it could be a muscle spasm. And it could be anything, but I couldn't really say, because I don't. And a lot of times, some people ask questions because they think maybe I've had some experience with that specific behavior, and that I might know why it happens or what the solution is. But this is kind of general, and I do know horses that do cow kicks, and it's just out of the blue, but I don't really know why, except that they're reacting to some sensation. So she does some Masterson Method techniques on him. And all I can say in a situation like that is you just need to keep working on the horse and keep doing the whole body and see if there's any improvement. Because I don't know specifically what that cow kick might be. It's just something's bothering the horse. Could be a groin muscle. It could be a lower back issue. It could be a sacroiliac issue. It could be any number of things. It could be a fly. She said it's like he's swatting at flies. In which case, you need to do some body work on the fly. But not really. But anyways, on the run. Okay, that means on the fly. Okay, but the answer to that is I don't know. When I come across a case like that, I'm working on the horse, I just keep working on the horse and see what shows up, because we do read the horse's responses with this type of body work, so we often can tell when the horse is responding to one particular technique, more than if you're just doing a modality where you're just doing the modality. And with this type of body work, it's all governed by what the horse is telling us as we're doing the body work. So when you pay attention to what's going on with the horse as you're doing the body work, a lot of times it'll uncover something or an area that might be bothering the horse that might be related to that behavior. So I would recommend, and do you recommend one move more than others? You need to do the whole horse. So the atlas is really important with anything going on in the horse. But after you start at the front end, you do the front end, the atlas, the neck, the pole atlas, the neck shoulder withers junction. You move to the hind end, you release tension in the hind end, then you move towards the middle, towards the midsection. But I would definitely spend a lot more time on the hind end techniques and have a lot of patience when I'm doing the points behind. And I would take a long time doing the hind leg releases. Just hold them in the farrier position until your back is getting sore and you start kicking out. And then do them very slow. Because when you hold the leg up in the farrier position, that allows the horses, that whole junction behind, the sacrolumbar junction, the sacroiliac, the groin muscles, the psoas muscles, that allows them to relax when you hold the leg up in the farrier position. So then from there you go very slowly down. Now the problem is your back usually gives out before you're done with that. So you can do it in increments. You can do a little bit, do a couple minutes of that, and then put the horse's foot down, take a break, maybe go to the other side because the horse probably will be switching legs by then, and you can do those leg releases in increments. But the point here is that when you do those leg releases in the farrier position, the more time you take holding the weight of the horse's leg as you're doing them, the more effective it will be. So that would be my answer to that. If anybody has any comments or any experience with any of these situations, you can go ahead and speak up, especially if you've got an answer to it. So, all right, we're going to the next. Oh, wait a minute, no questions. Next one. Other than moving the stifle in and out and judging the relative mobility, so this will be from another student, because we do a technique where we mobilize the stifle and the hind limb by bringing it in and out. Other than moving the stifle in and out and judging the relative mobility, is there any other way that you determine if the horse has stifle issues or a possible source of discomfort? That's the first question. And stifles, for me, aren't that tricky. When you put your hand down inside of the horse's stifle, if he pins his ears and swishes his tail and kicks you, then he's got sore stifles. You didn't even have to kick you. If you put your hand inside his stifle and he swishes his ears and swishes his tail and pins his ears, there's some discomfort there. There's some soreness in the stifle. So the question is, how bad is it? And it might just be that it's very sore muscles. Depending on the horse's job. Now, if your horse is a cutter and a reiner or is in high-level dressage and you put your hand down there and he's sore in the stifles, that's a little bit to be expected. Because a lot of times horses in those sports are kind of pushed a little hard, and probably a little harder than they should be, because if you're conditioning a horse properly in stages, the horse shouldn't suffer that kind of discomfort. But they do, because they're working horses and they're athletes. So you put your hand down inside the stifle, and you get those large, reactions or responses, swishing the tail, pinning the ears, or picking the leg up. Then his stifles are sore. The good thing about knowing this is you've caught it pretty early. You've caught it before it becomes a ligament problem or a joint problem. So by knowing that, you can adjust your training regimen, and you can do body work to loosen up the stifles and the muscles and ligaments and tendons around the stifle. So that's the good part of that. I mean, that's so easy to do, and it just makes sense. So if you do this, and you want to know, well, what is it? Is it a tendon, a ligament, or a joint? That's going to take a little more, probably. At this point, you do want to call the vet, because he'll do an lameness evaluation, and he'll tell you if it's so bad that the horse is showing up lame when you put stress on the joint. But if you can catch it early just by paying attention to what the horse is saying, it won't reach that point if you do something about it in the meantime. There are other checks for stifles, but this is the best one. I mean, you've caught it early. So the second part of this question is, can you clarify the knee button, exactly where that is and when and how you use it? So the knee button, when we're doing the scapular releases on the front end, we're supporting the weight of the horse's leg, and we're gently lowering it to the ground so that the scapula moves, drops in relation to the body in a relaxed state. We're supporting the weight of the leg, so the muscles are relaxed, either completely or as much as we can get them. So as you're doing the leg release down and forward or down and back, that's a lot of times you reach a point where the horse just can't quite let it go the rest of the way, and so there's a knee button inside the knee that you can tap with your finger that causes a reflex reaction in the horse to let go, to just let go of the leg. I imagine it's kind of like the, you know, the old movies or cartoons where they popped your knee with a little hammer and your leg went like that. It's similar to that, but not as funny. So the chart. Oh yeah, maybe this we have. Oh, Cindy's telling us about the wall chart, and it's only okay. I'm gonna see if I can find a picture of the knee button, and it's where it's on the inside of the forelimb, and it's if you put your hand on the inside of the horse's leg, and you at the knee, and you'll feel as a little groove where the horse's knee bends. So if the knee was my finger here, let's do that. Okay, here's the horse's leg, here's the horse's knee, and here's all the people. No, here's the horse's knee, and this is the inside, and right here where it bends on the inside is where the knee button is. And you can feel where if you rest your finger there, or fingers on the inside of the knee where the horse's leg bends, you'll feel where that is, and that's where the knee button is. And that's the point you put your finger on and tap it or hold it at about great pressure. You don't have to put it, grape, G-R-A-P-E. You don't have to put a lot of pressure on it. You just have to tap it, and the horse's leg 9 times out of 10 will let go, will go down. And so that'll give you that last bit of release you need in the scapula. So that's where the knee button is. I'm going to see if I can, there's a picture of it here. Don't have it in this. Let's look in the book here. Here we are at the front leg releases. And we may have an actual picture of it. There should be a picture in here if there isn't. Oh, here we go. So here's a picture of the knee button is right here. That's the inside. Whoops, let me see if I can get it clear. That's the inside of the left front leg. And there's a bone, there's a little indentation there. And there's a tendon that runs right down the inside of the leg, the whole leg. And actually where it goes over that joint, where the knee bends, is where you're tapping. And that's in the Beyond Horse Massage book. That would be on page 84. And so even if you don't have it now, this is being recorded and it'll be archived on our website. So you can go back and listen to that. Kim Knutson has a question. Back to the corkscrewing discussion. I've seen it this few times. Do you have a perception the horse? Okay, a corkscrewing question. I think that discussion, that's when the horse's neck goes flat. When you ask the horse to bend laterally, bend the neck, a lot of times the horse's head will go flat and corkscrew around to the side. I've seen this a few times. Do you have a perception of the horse moves in the fashion they need to aid in releasing themselves? Okay, so our question is, do you have a perception that the horse moves in the fashion they need to aid in releasing themselves? Well, I know that they move in the path of least resistance. So if you're asking a horse to bring his head to the side and lateral bending, and they start to go flat like this, it's because the vertebra of the neck don't have, there's restriction wherever it is in the neck or in the joint or wherever, that's inhibiting the lateral movement of the joints. So when you ask them to bring their head around to the side, they bring their nose around, but since it won't bend laterally easily, they bend this way, but they put their head sideways. So they're doing what you're asking. They're bringing their nose around because you're asking them to, but since it bothers them to bend this way, they do it this way. So they're taking the path of least resistance and the path of the least discomfort. When you're doing body work on the horse, so the question is, do you have a perception the horse moves in the fashion they need to aid in releasing themselves? Once you bring the awareness to the problem, the horse's body will start to let it go. It may be a little uncomfortable for them, but they'll release it. If it feels good for the horse to release, they'll move in that fashion. So in that sense, they'll move in a way that aids in releasing themselves. So that's how I probably would look at that question. If they're feeling that it's making them feel better, they'll go that way. So the answer to that question is a lot of the times they probably do. They probably do go the way that feels the best. But if they're trying to avoid discomfort, they'll go around it. They'll go around the discomfort. So does that answer the question? Is that the question you meant to ask him? You can type in an answer, or you can say so on the phone. Is that the same question? Okay, Kim. So you can, if you want to type in whether that answered your question, because if it didn't, let me know, because I'll try to answer it. We have another question here. Not sure if I can ask a question here, but in your experience, what other places in the horse's body do known stifle issues affect that we can give extra attention to? Sore stifles affect, in my experience of working on a lot of horses with sore stifles, it affects the flanks and the lumbar on the same side. And so the lumbar on the same side of the stifle, especially right in front of the tubercoccyx. So if you have a horse with stifle issues, known stifle issues, you can release that compensation, that compensatory pain or discomfort in that area. But over time, when a horse has an issue, let's use the stifle issue as an example, they'll start to get sore there, but they're going to also start compensating other places in the body. The more sore it gets, the more they have to compensate. And also the more, this is just kind of my way of looking at it, the more they have to compensate in other areas and those areas become tight, then they have to compensate in other areas. So it's that chain reaction. So they'll get sore in the whole hind end, in the sacroiliac area, in the sacrolumbar junction, and they're going to have to compensate on the other hind limb, and it might show up in the sacroiliac and in the hocks, and in the gluteals and hamstrings, and maybe eventually the hocks. So it's kind of a chain reaction, but the first place that I associate with sore stifles is that lumbar area and flank on the same side as the stifle. And when you pick up the hind leg and rest it in the farrier position with the foot kind of towards the midline, and the stifle doesn't fall out, it's not relaxed, it's clamped in, those are the horses that will end up having sore stifles, because those muscles are going to tighten up and tighten up and tighten up. And stifles have a lot of soft tissue involved, as opposed to hocks, where there isn't a lot of muscle and involved in hocks. In stifles, there's a lot of soft tissue around. And so the stifle issue starts as a soft tissue problem, muscles, tendons, and ligaments. And if that goes on long enough, it starts to affect the joint after that. So you catch it early when it's still a tendon and a muscle and ligament issue, you can prevent it from becoming a more serious joint issue. I think a lot of joint issues happen with horses where there's unilateral tension on a joint, or what I call torque. And if it stays that way or gets worse and worse and worse, it starts to put stress on the joint, and then it turns into a joint problem. So I guess the simple answer to that question, for me, stifles show up in the lumbar and the flanks on the same side as the stifle. Any other questions? Okay, none on there? Okay, so I have some more here. No more questions? Okay. Okay, here's one about an ataxic horse, ataxia. So ataxic means loss of coordination, and it's just a description of the behavior of the horse, I think. So I'll just read the question. Any suggestions for massage for a ataxic horse? My horse came in from a group turned out barely standing or walking. A group turnout barely standing or walking. On the ataxia scale of 0 to 5, he was a 4.5. Now he's better, probably a 2, she says. It affected both his hind legs. Treatment was DMSO for 3 days. Since June, he has been on stall rest with daily hand grazing. The last 6 weeks, evening turnouts for an hour or so. The last month with a mare, and they play and fight. So it sounds like he's doing better. I've had him evaluated by several vets. One ruled out herpes, EPM, protein fine, which means fine on the whatever the protein test is. I'm not a vet, so I'm not going to pretend to know what all of this is, but neck x-ray fine, some arthritis, but he's 22. Another vet, lameness expert, diagnosed that he had been T-boned by another horse and has a bulging disc where his neck joins his chest, C7T1. She said, I didn't need to spend any more money on chiropractic treatments. He runs, trots, canters, but crookedly. Front half of the body fine, but still the back half goes at an angle. He runs and bucks and farts in the arena. I'll read the whole question. This isn't public television, so he's crooked in the air when he bucks. Lands okay. When I walk him in the aisle, I walk on the right side. If I'm on the left, he pushes me into the wall on the left. He doesn't really like his back hooves cleaned, and he isn't sure of his balance. I have more success doing the left hind than the right. I've not returned him yet to the herd of 24 horses, as I think he couldn't handle the rough and tumble, so he goes out at night for an hour or so. We've had a lot of mud, and he has handled it. He can roll and get back up okay, including on softer ground. He doesn't seem in any pain. I've hesitated to do massages. I don't want to do anything wrong. I'd like to put any input you might have on best to help him. So he's 22 years old. So first of all, it brings up the question, when a horse has an issue, like, what's the goal for the horse? Is the issue is it interfering with the horse's job or his life? And if it isn't, then there's less urgency about trying to fix it, you know. So, I mean, you want the horse to be comfortable, but a lot, you know, when you're looking at a horse with a problem, you have to look at what is the horse's job in his life, and what's the goal for the horse. If the goal is just to make the horse comfortable in retirement in the pasture, then that whatever you're going to do is might be less severe or less urgent. So that's the first thing. So he's a retired horse. He's got a pretty good life, and the main goal here is to make sure he's comfortable. And so that's the first thing. If he was a performance horse or a working horse, then there'd be more urgency in finding out. You'd really want to get to the bottom of it. So, but now let's get to the problem. So, ataxia is just uncoordinated. You know, it's neurological. It's neurological, and it could be caused by an injury, by trauma, or it could be caused by something, you know, like EPM, something that affects the nervous system. So it's just a guess what caused it. But to make the horse more comfortable and more straight, the actual question is, I'd like any input you might have on how I can best help him. The hind end is showing up as where there's behavioral. Let's look at it from the point of view of behavioral performance. He's crooked in the body. He has trouble behind, which he picks up the hind feet, but he can do the left hind easier than the right. So there's something going on behind, but there's something going on in the front end, because one of the vets thought that he might have been T-honed by another horse. He has a bulging disc where his neck joins his chest. So again, this is an example of how the horse's body is interconnected. So you can treat what the problem is behind, but you got to always also focus on what's going on in front. So as far as what can you do with the horse, you need to do all the body work on the horse, but you do want to pay attention to C7T1, the scapular. Well, Atlas is always first. Then C7T1, scapular releases, getting under the scapula, and all these techniques are in the Beyond Horse Massage book and DVD. Do the scapular releases, the lateral cervical flexion, getting under the scapula helps release tension in the muscles that go over that C7T1 junction, and doing the C7T1 release is a little more, it needs a little more pressure. So in a case like this, you'd really want to ease into that, going in under the scapula, doing under the scapula and doing C7T1. You'd want to ease into that because you don't want to aggravate any injury that's happened in the past. But with this method of body work, we pay really close attention to what's going on with the horse as we do the body work. So if you're doing the C7T1 release as described in the book, you don't want to just start pushing on the horse. You want to ease into it an egg yolk at a time. And when you reach the point where the horse starts to get uncomfortable, you soften a tiny bit, and he releases some of that discomfort, and then you continue on. If you reach the point where you can't continue on without making the horse uncomfortable, then you stop. That's where the horse's limit is at that particular time. When you come back again later, a few days later, you might be able to do that again and get a little farther, or you might run into the same spot where you want to stop. So in any case, you're going by what the horse is telling you. So that's one area that's showing up here. I already talked about the longissimus dorsi muscle that attaches in the lower neck on the front end and goes between the scapula and attaches at the pelvis and the sacrum on the other end. So it'd be really interesting with this horse when you're doing the front end, the C7T1 area and the scapula releases and underscapula, to pay attention to what's going on behind. If you're doing those techniques in front and the horse starts to wobble behind or stomp behind or kick out behind, it's because he's feeling the effect of releasing down here with the hind end, which means there's something related here to the hind end that's related. So when you do the front end in that C7T1 junction, you want to pay attention to what's going on behind, because that'll tell you if they're connected. And I'd be surprised if they weren't in a 20, especially in a horse that old, that this has been going on for a while probably. And then when you get to the hind end, you want to do the same thing. You want to spend a lot of time on the points, hind end points, and you want to spend a lot of time on the hind leg release. And in his case, where you have trouble with picking up the hind legs, you don't want to pick his legs up as far. You want to start wherever the horse is most comfortable. So if the horse is more comfortable, when you go to pick up his hind feet to clean them behind, bringing the toe back, if you just pick it up a few inches and that's where he's comfortable, that's where you wait. And you let him rest in that position till his pelvis starts to drop and drop and drop on that side. And as it relaxes, it releases tension. Then you do the other side. You go where he's most comfortable. If you pick his leg up forward in front, in the farrier position, if that's uncomfortable for him, you don't start there. You start where it's comfortable. And then you would come back up to the front and start lower to the ground. And he's 22 years old, so he's a lot of things have tightened up in his body through the whole trunk, probably, it sounds like. So I guess the point is you need to do the whole horse and pay attention to what the horse is telling you as you're doing the body work, and focus on releasing those areas. Again, not over-focusing on fixing anything. But all of the techniques, especially on a horse that's that old that the tension has layered up, layer by layer by layer, you're just going to have to peel off the layers. And the urgency's off, isn't there here, because he's, you didn't say whether, you're trying to getting ready for the Grand Prix at the Olympics in next year, but I kind of doubt it. So you can kind of back off a little bit on the worry about it, but I understand your concern. You want to make him more comfortable, and that's how I would look at it. I would do the techniques kind of in the manner I just described. So rescue horse that has been diagnosed as having a patellar fixation. Either somebody is running the garbage disposal, or there's a Martian in your house or something.
Flushing the toilet.
Oh, okay. That's a relief. That was a joke. Okay. There was a question about a patellar fixation. Locking stifle. When the okay, I'll keep going. A patellar fixation is a big fancy word for a locking stifle. The patella, which is the kneecap, when the horse moves the leg, slides up and down as the horse moves his knee, which is his stifle, which is his knee. So the kneecap goes up and down. So and this is just a basic understanding of it, which is my understanding. And the ligament that goes over the patella slips off to the side on some horses, and the patella stays stuck up. It stays stuck, fixated up, and then it locks the stifle, so the knee can't bend, the leg straightens. I think there is a surgical procedure for that, or they either snip the patellar ligament, or they do another ligament, but they do there is a surgery they can do that helps that in a lot of cases, and I don't know exactly how it works, but the body work won't necessarily make that better, because with this type of body work we loosen everything up, and in my experience, when I work on horses that have locking stifles, after the body work, sometimes it's worse. And then after about 20 minutes of walking or you know, the muscle toning, it improves again, back to the point where it was before. So, you know, the answer to that is I haven't had much success with fixing locking stifles. So that's the answer to that question. Now there is there is a veterinarian in Florida, Peggy Fleming, who I did a seminar and a course at her place, and she's pretty amazing. She does chiropractic and she does acupuncture, and she'll treat the pelvis, rotation of the pelvis for locking stifle. And I think she explained to me that her theory was when the pelvis is tilted forward, then it creates slack in the ligaments, and the ligaments that affect locking stifle, maybe the patellar ligaments. And when you adjust or treat the pelvis with acupuncture or chiropractic that she does, she says she has success in treating locking stifles because it adjusts the pelvis. So my experience with our type of body work has been that I don't see an improvement in locking stifles. So